trials that are looking at all comers, but looking at mutations in the PI3 kinase pathway to try and see whether or not patients who have a mutation in the PI3 kinase pathway are more likely to benefit from, say, PI3 kinase inhibitors. But I think the real meat is actually in exploring multiple, as I mentioned, pathway changes. So mutations in multiple different parts of the same pathway, or at least some part of the same pathway. And trials that are looking at that include the neoadjuvant studies, and I think they're very, very important, as well as the adjuvant studies that will have a longer time to endpoint. One neoadjuvant trial that I think is really important is the concept that's embodied in the I-SPY trial design, where you give a novel agent along with standard therapy. You compare it to standard therapy, but you get serial biopsies where you can look at general pathway changes to try and identify which tumors are most likely to benefit from a specific therapy. That could then direct us to much smaller trials in the future that are directed appropriately to the right tumor biology.